Hello and welcome everyone to Autism Demystified with your host, Dr. Vladimir Bariev, general pediatrician specializing in autism for children. Today we have a very special guest with us, a close friend of mine, Dr. Michele DeSimone, who is the owner and director of the Sensory Studio with now 4 locations. She has forged a career based in service, in caring for her community and caring for her patients. He is a fantastical speech and language pathologist. She has over a decade history of serving the community in her practice. She's served thousands of local children, empowered hundreds of young therapists, and fueled a personal dedication to service far beyond her practice. And we are very lucky to have her join us today on the show. Michele, welcome.
Thank you so much, Dr.
All right. So I'd like to start out by talking about families that we see in our practices and understanding just how much they can help their children make bigger progress, more sustained progress with their therapies, with any kind of interventions that we offer them, just from setting of boundaries. Can you speak a little bit about what you speak with your patients about as far as having parents set boundaries for their kids, and just what type of challenges parents should expect and what kind of rewards they get afterwards from maintaining those boundaries?
Sure. So, in autism, self-directedness is very common. Self-directedness is when a child focuses more on what they are interested in doing and they move, they navigate through the space, not focusing on the adults or the people in the space, but rather on the items and just navigating the space on their own. So when we start to set boundaries for children and we place demands on them, if we place a demand or give a command and the child doesn't respond to the command and they keep moving about the space, then the child, over time, as we keep on doing that, the child learns that it's okay to not respond, and that self-directedness becomes stronger. So it's just eventually becomes a more ingrained habit, and that becomes the norm for the child. So what's important is actually when it's necessary for us to set a boundary or to give a command, we make sure that we go, even if the child isn't able to follow that command right from the beginning, when we set a command, we want to be able to go and follow the child, take them from behind and do almost a hand over hand or body over body mimicking to show them how they efficiently follow that command. And over time, the more we keep children functioning within boundaries and able to understand that when commands are given, a response is necessary or an action is necessary, children become less self-directed and more interactive and more reciprocal. And that's what we're working toward. We're always in therapy working toward spontaneity, reciprocal interaction, and the ability to follow directions and commands. And that's not to say that we don't want children to be who they are and to have freedom. But in a school setting, it's important to be able to follow those directions in order to sit still, attend, and learn. So those are skills that we do have to teach.
Absolutely. And how do you respond to parents when they say, there's a common concern that I hear, that they behave far better when they're in their speech therapy sessions working with their instructor and their clinician than when they are at home with me and we try to get them to do anything. We struggle so much in getting them to replicate or generalize the skills that they're learning there. Well, what steps should parents take in those situations?
Sure. So the first thing to say is home is a more or is a less structured environment. So it's natural for children to comply less, to be wanting to navigate the space more independently at home. In the speech therapy setting or occupational therapy setting, or even in school, we have a benefit that the parents don't have, right? We have this isolated situation where we can actually, through our the way we praise and the way that we show them that we don't like something, like that's not what we do, or holding them by the hand and guiding them, just from the second that we are leaving the parent at the level of the waiting room, all the way down the hall, through the gym, into the private treatment room. All of that is opportunity for us to help guide the child on what we like to see and what we do not like to see. And we use the tone of our voice to teach that skill. We also use a guiding hand. We use small commands like wait, hold on, follow me. Those are all really, I mean, we, the providers, have a benefit, right? We only see the child in these isolated situations. We don't have them the majority of the time. So there's no blame or guilt that should be had from the parent's perspective. Home is definitely a less structured environment. So children are going to perform in a less structured way. In the therapy session, we, from the very beginning, are guiding that child to kind of function within the boundaries that we set. And like I said, we're in this isolated situation. So in our therapy room, we can give a simple command, come in and sit down. And if the child doesn't sit down, there aren't that many places to go within the therapy room. So we have the opportunity to use a guiding hand. Come on, we're going to turn. Come on, I'll help you get into your chair. I want you to sit here. And it's important. Sometimes I talk about a rubber band. So if I let a child stretch the rubber band so far, sometimes I can't bring them back. So I want to keep those boundaries. When a child doesn't know me well, I want to keep them fun and friendly, but also tight, because the further we get away from where we're supposed to be in the session, the harder it is to redirect the child. And then we may lose session time. So many of our sessions are only 30 minutes. So it's really important that we maximize and intensify all of that time, because it's such a short period that we have a lot to teach during that time. So I think that it's not realistic for the parent to assume that they're going to be able to take on the same level of structure in the household. So it's important to talk with the therapist. And usually at our sessions, the therapist comes out at the end of the session. We'll have a conversation with the parent. We'll tell them exactly what we did, how their child did, and what the parent can do to carry over that stuff at home. So we really try to give the parents these small tidbits of, hey, he's doing this really well in the therapy room. I want you to try it at the table at home when he's sitting doing a preferred activity. And I want you to use these specific words of praise, or I want you to use these specific commands that we've already practiced, that he feels successful doing. And then you can use the same words of praise that we're using, and it will sound familiar, and he'll start to feel good and happy and want to carry that over at home.
That's wonderful. And you mentioned something about the carryover of the skills they learn during a session and doing things at home. For the families who are ambivalent about that and say, well, why should I really do much with my child at home when they're getting all the necessary instruction time during their speech therapy session? How important is it for me to continue what they're doing, or does it actually make a difference in their outcomes? Would you help to address, then dispel some of those myths that
Right.
that the majority of their actual improvement doesn't only happen in these sessions?
Right, of course. We have the child for 2, 3, 4 half hours a week. It's nothing compared to the amount of time that the child is home with a parent or in school with a teacher. So it's really important that we start to create some routines, and we'll do that in the therapy session. And those are the things that we want to carry over at home. We want to help the parent create routines of activities, to create routines around meals, reciprocal conversation around meals. And we give very specific examples of what those can be. We even give checklists sometimes of what the parent can, what types of probes and what types of conversation the parent can bring up during mealtime. And also around bedtime and bath time. All of those routines within the house are really critical for creating routines. So the child, I talk about teeth brushing often, and how in a child with sensory issues, they often refuse, they're defensive, orally defensive, they don't want to brush teeth. So my recommendation often to parents is, okay, you're going to explain to your child that we're going to go into the bathroom and we're going to explore with the toothbrush. In the bathroom, I like to set a kitchen timer for 30 seconds. So the kitchen timer is on for 30 seconds. We don't start that timer. We start that timer right from the beginning, right when I'm taking the toothbrush. The timer's set. I take the toothbrush, I put the toothpaste on the toothbrush, I hand it to my child. If my child wants to brush himself, he can do that only until the kitchen timer is finished. During that time, the child may be screaming, flailing, refusing to brush, but during that time, if that's happening, I'm going to lay the child in my arms, even if it's a big child with his head resting on my shoulder, and I'm going to do the brushing. Even if he's refusing, lips are closed, I'm still doing gentle brushing, showing him that this is going to happen every single day, 2 times a day, no matter what, in a I use sometimes a great neuropsychologist once said to me, sometimes we have to use our Hannibal Lecter voice. So child is flailing and screaming and really having a fit because this is not what he wants. He wants to defy and get away, and it's uncomfortable and it's a sensory experience that he doesn't want. It's okay. We're going to brush our teeth no matter what. We're just going to brush our teeth because we don't want those bugs to live in our teeth, and we have to clean them out so that that's going to happen. And boom, the timer went off and you're free. And he goes. So the bottom line is, no matter what, every single day, 2 times a day, that kitchen timer is going to be set, and we're going to be doing it. For my own child, who is not on the spectrum, but at 3 was completely orally defensive and did not want to brush his teeth, it was recommended to me by my dentist to do this, and it was completely successful. 2 weeks it took. That he continued to fight, and he didn't want to do it. And I remember going to the dentist at 2.5, and the dentist was like, he brushes his teeth, right? Or you brush his? And I'm like, no, he refuses. And the dentist looked at me and said, but your mom, and there are some non-negotiables in life. And whether your child has disability or not, we have to brush those teeth because he's drinking milk or he's, having juice, whatever it is, he's eating food. We have to get those teeth brushed or you're going to have a big problem later. It's about the investment now. And with behavior, it's the same thing. We really have to make that investment now when they're little to set boundaries and show them how to function within boundaries. So then when the children go to school and natural boundaries are set within the classroom, they're able to better cope. I like to talk with parents about adaptability and how if my child is rigid and inflexible, he's going to have a lot more difficulty in life across all arenas in life, right? Every environment is going to pose these concepts and constraints that are going to be uncomfortable for my child. But if I can embed in my child and work toward flexibility and adaptability to the environments, rather than me changing the environments for my child, he's going to have a better life. He's going to be more easily adapted. He's going to be able to adapt well in the classroom. He's going to be able to adapt well on the playground with his peers. So I always express to parents that routine is important, but routine with flexibility. My son loved when he was little to read the same book every night. And I was like, great, that's okay. He likes the same book. But after a while, it was when I wanted to, okay, well, it's Halloween time. Let's get a Halloween book. No, I want the same book. That's where we create rigidity. So it has to be, okay, we can do the same book, but we're going to add in a new book too. Or we can do the same book tonight, but tomorrow we're going to do a different one. So setting expectations is important. Sometimes picture schedules, things to not just keep everything the same, being able to embed a little bit of discomfort in our controlled home environment so that when he's at school, everything's not so uncomfortable. He understands that he's not going to have full control and that the teacher is, and we have to be able to function within those boundaries.
Yeah, a lot of the things that you are mentioning just light up my mind to think about how, parents would tell me, I asked them about developmental skills in my clinic all the time, and there are different milestones and level of functioning. And the parents say, oh, well, yes, my child is able to do this skill. I say, that's wonderful. Now, here's the question. Are they doing it on command and consistently? Are they able to demonstrate just how wonderful they are and to show the teachers? or to
Right.
show us in a clinical environment. If they can't, then that's a problem. If they're not able to demonstrate just how wonderful, then there's no way that they'll be able to get credit for their progress in the development skill. That's part of the flexibility of being able to
Yeah.
follow along with an instruction and be able to demonstrate something on command.
Mm-hmm.
Is a big component to flexibility for a child. Now, I'm going to ask a question that we've had uh, on the forefront of our minds, even in my household. So, so when it comes to helping a child uh, play with their peers and integrate with their peers, are there different recommendations you have as far as introducing them, especially if they have autism, to peer groups or to structured activities where they could practice their social skills? Anything like that you'd recommend?
Yes. So at my center, we actually we've had this for many years now. We developed it. My coordinator Jamie and myself developed it together based on what we were seeing in children. So very often parents come in for our intake and they state that I say, is your child around other children? Does he have the opportunity to play with the same age peers? And if he's a child who's not yet in school, the parents often say, yes, we go to, the gymboree or some type of play group. Consistently every week or 2 times a week. And I'll say, actually, before I even say it, often what comes out is that the parents say they're so embarrassed and they had to stop going because the child does not participate during the center time or the circle time. So, for example, like Kids United Soccer is something that you can go to, and the children will be directed to do certain activities. And if your child can follow along with the group and do those activities, then he will do well in the group and he'll continue. If he is not able to follow the group or is, let's say, self-directed and doing his own thing, you'll get some feedback from the moderator or the coach that will say, hey, we want to help him continue to be with the group. But what often happens is these play groups like Gymboree, they are happy for children to just explore. And I like that. I think that's important for children to feel the freedom outside of their own home just to explore, like on a playground or in a play group. But that is not actually teaching them the skill of being reciprocal and attentive. So where I like, for example, on Staten Island, we have kids gym. It's a great opportunity for kids to go and play and be exposed to other children without really any demands placed on them. There is a circle time that the children have the opportunity to go into the middle of the group and play. But sometimes parents are reporting back to me, my child gets up, will not participate in circle time, goes away to his own activity that he wants to do, but that's okay. So here at the Sensory Studio, what we do is we have a peer group that the first 15 minutes, it's run by all therapists. Sometimes there's helpers in it too, but we usually have a 1-to-1 ratio where it's one therapist to one child, and it can be 8 to 12 children. Sometimes it's smaller if there are absences, but there's 15 minutes of free play. So we go out into the waiting room. We bring all the children in together as a group, like a class. They line up. If they're having trouble lining up, their partner provider, which is a therapist that's there just for them, is holding their hand, guiding them back into the line. We're showing them how to actually follow these directions, and we're keeping them together. We come down the hallway. We have a certain spot where they have cubbies, and they all put their little snack and their drink in the cubby. They took off their shoes and their jacket, and they put it there. If they're having trouble doing that, we're not allowing them to run into the gym with their shoes on. We're keeping them there. And that 1-to-1 provider is showing them, no, we're not going that way yet. We're taking off our shoes, and we're hand over hand showing them to do it. Then they go into the gym and they have 15 minutes of free play where the therapists are there, keeping them safe, but letting them do their own thing. They do the full 15 minutes of free play. In our gym, we have slides, we have a rock wall, there's climbing apparatuses, there's a trampoline, that all different things to do that are fun for the kids. At the end of the first set of 15 minutes, a bell rings, and that's the children's guidance to come into circle time. So we have a blocked off area with little baby gates that go around, and every child sits in circle time in a big circle where they're play activities in the middle, and each provider, each therapist sits behind the child. If the child is self-directed and wants to get up and move around, sometimes we scoop the child up and we sit them in our lap. And it's not to say that some children aren't crying for the first, second, third, sometimes fourth session. But by the end of the 8 weeks, and sometimes we go on 12 weeks, in the summer, we're 8 weeks. During the school year, we go nonstop all the way throughout the school year. And we have the peer groups 2 times a week, but children come 1 time. So it's 1 time a week for an hour. They do 15 minutes of free play. They do 15 minutes of circle time. And during that circle time, it's directed play. So they have to stay in the circle. If they want to get up and move away from the circle, that one-to-one provider is following them, scooping them back in, getting them back in the circle, and happily showing them how they can have fun together with the children during this directed time. At the end of the circle time, and during that, there's a lot of reciprocal play. So it's okay. We're singing songs. We're doing the parachute with the balls. We have the huge ring stacker. So every child gets a different color. And when your color is called, your provider will help you go to the middle and put it in. We do a lot of sharing activities. After the 15 minutes, another bell rings. And now they have 15 minutes of guided cooperative free play. So they go back to the gym where they feel free. And now let me just preface this by saying the actual circle time strategically is in the gym. So our circle time, we want it to be in the gym so that they understand, because this is directed play time in circle time, they cannot just get up and go play, but we want that almost as a temptation. We want them to still know that the gym can be there. It's not going to go anywhere. But during this time, this is where we are. We're at circle time. And they can still see it, and they can still know that they'll be at it after. They'll be able to have some time to go after. So then so it's 15 minutes of free play, 15 minutes of circle time, 15 minutes of cooperative free play. So now we pair them together with another child, and they go into the gym and they play cooperatively. So they're doing, if someone likes the slide, the other child is guiding them down the slide. And again, the providers are there to help. The last set of 15 minutes, they go into what we call our kitty kitchen, and they sit at a long table. The parent has sent a snack and a drink, and we sit them at the table, just like in the school setting. Now, these children could be as young as 12 months, 13 months, all the way up to 3.5 or 4 years. And we tend to schedule the groups according to, it's usually like from 1 year to 2.5, and then 2.5 to 4, because these are often children who are not yet in school. So during that last set of 15 minutes, they're at the long table, they have their snack and the drink on the table, and the providers, who now they feel comfortable with as their people, elicit conversation between and amongst the children. So some children don't talk yet, some do. We ask them questions like, who has pets? Oh, you have a pet? Great, tell us about your pet. And even if they only know the name of their pet and they can't even say it well, we'll listen to it, and then we'll encourage the other children to talk about that type of animal, and we'll play a little animal game. So they really get the exposure of, free play, which is what motivates them, combined with directed play in a circle where they know when it's circle time. So honestly, by the 4th session, even the children who were crying now know this is circle time. Even if I try to get up, just like brushing teeth, even if I try to get away, as long as that timer is going, it's not going to happen. So eventually that behavior becomes extinguished, because if you try and, if you call your friend every 2 days and say, hey, let's hang out, and every time they're like, nope, I can't hang out. After a couple of weeks, you're going to be like, hey, when you can hang out, call me, right? So you start to learn how to extinguish these behaviors, these less desired behaviors. And the children really learn. They are so smart. They try. And when they see that it's not going to work, they quit. And instead, they start to really enjoy participating in the group. And I think of all of the things that we do. I mean, children make tons of progress in therapy, but the peer group is often the parents' first opportunity to let their child go. And sometimes I tell parents all the time, I'm like, listen, if you're uncomfortable leaving your child, I promise you, we are going to keep him safe. He's going to have a one-to-one person with him the whole time. If you feel like you need to cry, it's okay, but don't do it as you're dropping him off. Say, look, it's going to be so fun. Here's Miss Michelle. There you go. And then turn around, go to your car and cry while he's not watching. Because sometimes we need to do that when we're letting go of our babies.
Yeah.
But the bottom line is when they're here, we're always working toward a goal, right? We're working toward progress. And I think that redirecting self-directed children back to the group is what they need to be able to function in the classroom. So as early as we can start that, that's going to be best for your child.
That's incredible. So you have them seeing how their peers engage and follow along with the commands. You have the one-to-one redirecting them during that whole time, and you even bring in the amazing temptation of being able to do fun activities and physical activities into learning social skills and learning even speech skills, things that
Right.
are traditionally historically have been just done at the table.
Yep.
Sit down, look, don't play while you're learning speech. Just sit
Mm-hmm.
and don't move. Now you bring in this whole extra dimension of them engaging in activity, and that's a really powerful thing. I don't know of any other program that does quite that, all that engagement, but I can see clearly that it's very, very powerful, and it shows just how much you are in tune with what kids respond to most. Like self-directed kids, they as you know, they many of them love movement activities to get them to motivate them to engage in any kind of educational
Mm-hmm.
activities. So uh, I can understand why that's been so successful for you and the center. um,
I do
can
think
you
that it's important for parents to learn how to redirect their own children. You know, something I see in intakes all the time, which is our very first appointment with the parent before they're getting therapy or peer group with us. Parents are sometimes afraid to make their child uncomfortable. And I know, as you know, Vlad, and I know, learning to be uncomfortable is the key to growth, right? You
yeah,
have to learn to be comfortable being uncomfortable.
yeah,
And often, you know, it's normal. It's completely typical for a toddler to cry, to demonstrate avoidance. Like that's how toddlers avoid. They cry to show they don't want to do something. But just because they don't want to do it or it's uncomfortable to them, it doesn't mean it's not good for them. And that's where they need the parents' guidance and the parents' reinforcement, right? So, like, if I say to my daughter, here's your lunch, and she looks at it and she says, I don't want that. You know, it's up to me to say, I know you don't want that, but these are really good for you and you're going to love them. Try them. I don't want to. And the option is not I go back to the fridge and I find something else and I make it for her and I give it to her, because guess what? That's not good for her. It's not good for her to have lots of options. It's good for her to learn this is what lunch is. And listen, I'm not trying to feed her liver, you know. I'm giving her, you know, things that are healthy for her body, but also attractive to a child. And I think sometimes especially in toddlers or like children, you know, 8 months to 2 years, newer parents are, as soon as their child cries, they think that they need to change. They need to alter the environment. They need to change the activity. But that's the opposite. We need to hold strong. If we know that it's just putting their shoes on and they don't want to do it, you know, when you're in a rush, like, you're going to get those shoes on if that's what has to happen, right? If you're in a rush, you're going to put your child in the car seat. You're not going to say, oh, forget it, we're not going to go, or all right, we'll be a half hour late. That doesn't work. It's just like your child playing with a knife. You're not going to let your child play with a knife. You're going to take the knife away. And if they cry, you're going to say, I'm sorry, this knife is not good for you. But it seems like with only serious things like a knife, that's the only time many parents have the power and the will to say no. But we need to have that restraint more often, and we need to kind of help our children learn that they really have to function within boundaries in order to be successful. And we can't keep changing the environment around them. They have to learn to adapt to what's there. And the playground is a great time to do it. Sometimes I see parents talk to my daughter's 5 and she loves the playground, and she's a great, she grew up in the studio, so she's a great sharer. She wasn't always. The 3-year-old year was really tough, but now she's excellent and she loves to help kids. I often see parents whose child is self-directed or rigid, needs it a certain way, will ask my child to move over and let their child go first. And I don't get involved on the playground, but I'm watching it saying it would be really good for your child to learn how to wait, because not every parent's going to say, sure, Emma, move over, let him go first. That's not what always happens. We have to teach the children, our own children, to really learn to be adaptable.
Absolutely. And by the way, what Michelle and I are saying are not to take it to the extreme of being like Joseph Stalin and telling your kids no for every single thing, every single time,
Definitely not.
to the
Yeah.
point where they're like in tears and tantruming all the time because they're always over.
Fun.
That's
We
not
want
what,
fun.
yeah,
Listen, I play all day for work. I love to have fun, but I know how to have fun and have a child have fun while functioning within boundaries.
absolutely. They may cry initially, but they will get over it when they realize that this is the proper way that we interact. And importantly, just as important is that when we're, like you said, the Hannibal Lecter voice, we keep ourselves calm and keep our
Yes.
emotions in check. Because when your child tells you no, your natural response is to start raising your voice, to start speaking more rapidly to them, to start sounding more anxious and sounding like we're in pain, and that makes them more dysregulated and more agitated because of how we're reacting to their behavior. So it takes practice.
It
It's
does.
not a natural reaction to
Yes.
children
Takes
because these are our
mindfulness.
kids. It takes
Mm-hmm.
a lot of mindfulness, yes,
Mm-hmm.
but it is worth it at the end. Just as you said, every single penny of patience and focus that you invest early on in a child will
We're
pay
the
off.
model, right? We're the model for our children, especially with regulation. So and honestly, I have a 12-year-old and a 5-year-old. It took me a really long time to get here, so no judgment at
Same,
all.
same.
I definitely, when my son, who's 12 now, was 3 and having to get his shoes on to get out to school on time, and he would just refuse. I remember like going crazy. And I spoke to a friend who was a psychologist that said, you are getting wild, and that's why he's getting wild. You have to be more mindful. You have to lower your level of energy. You have to stay calm and show him, okay, if you don't want to put your shoes on, you're going to be late for school, and your teacher might be upset with you when that happens, but I'm going to wait and we're going to do that. And after 3 days of being late, he was like, Mommy, I don't want to be late. Let's get my shoes on. Let's go. So we have to be the model of energy for our children. And that's to say too, when they're upset, we can counteract their energy. You really have to kind of start to be in tune with the energy that your child needs you to bring to the table.
Absolutely. Michelle, thank you for all of that wonderful wisdom. There are many more hours and hours of conversation that you and I could be having, but we're going to have to end our show on this note. Once again, I would like everyone to remember that Michelle is the owner and director of the Sensory Studio. Officially, it's speech and occupational therapy for children. However, in reality, it's way, way more than that. There are things that are happening there that are teaching kids the ability to regulate themselves, to interact with their peers, to have some sensory integration, to do a lot more than what I just mentioned during our brief episode here. Uh, Michelle, can you please tell our viewers and audience how they can find you, how they can learn more about the Sensory Studio? What is the best means of contacting your center? And if you guys have any exciting new things on the horizon for everyone.
Thank you, Dr. Vlad. So you can find us at thesensorystudio.com. And we have one main number, although I have 3 centers on the island and we're in a couple of schools. You can just call the main number, and the first appointment will always be an informative session. So you'll share your main concerns and we'll talk to you about what we see while your child plays in our gym in front of us together. So there's really no worry. It's a comfortable session where we can just kind of understand what your worry is, and we can help you understand how to help your child reach their potential.
That's wonderful. So families, you heard it here. Navigate autism with confidence. if you have any questions or concerns about your child's development, please contact Michelle at the Sensory Studio. And if you are looking for a general pediatrician specializing in autism that can help you with the anxiety, the challenges, and the stress of navigating autism as a parent, you can feel free to contact my office. Both numbers will be in the show notes below. Thank you, everyone, for joining us, and have a wonderful day. And thank you again, Michelle. Bye bye.
Thank you.